My name is Victorian. I'm from Lyons Architects, and we're here today to present the Wonthaggi Hospital. So the Wonthaggi Hospital is a contemporary healthcare facility focused on representing the community by responding to the local region and also incorporating user-centric approaches in our design. So seen here on this map is the vast region that Basque Coast Health Service in the red zone, and then Wonthaggi there in the yellow dot. So it was really important for the hospital to cater to not only the local residents, but also to all the visiting holiday makers coming from Melbourne and elsewhere. This is an aerial photo of the existing hospital campus prior to the new development. So there was a confusing main entry that was coming off that main street in the roundabout, and then all these standalone buildings as well that were scattered around on the site. The delivery of this project is actually stage one, so that was the first of several stages that form the basis of the master plan framework. So siting the building was crucial to be in the appropriate location, not only for the facilities that it would deliver now, but also to anticipate the expansion that aligned with the master plan. Looking closer onto the site, so with this project we aim to improve the street presence on Graham Street, which is actually to the north, and seeing this building working as a pivotal point between what is Wonthaggi Township and the coastal reserves. So the building includes a new 24-hour emergency department and a medical imaging department. Operating theatres and the day of surgery facilities dominate level 2, and then on level 3 we have a new 32-bed inpatient ward. So we worked very closely with the hospital to create a whole new range of models of care. Another key focus of the design was to introduce salutogenic design principles, so that was maximising natural light where we can, and also providing a lot of outdoor spaces. And then thirdly, reflecting Wonthaggi's genius loci and the local community successfully showcases Wonthaggi's rich history as well. So we'll take a brief walk around the building, and we start down here on Graham Street, which was that main street to the north. So the 3-level building is actually set back quite a bit to create a new civic address, and at the same time it provides pedestrian access from the town up to the hospital, and then also an open landscape which will develop over time for staff and community gatherings. There's a generously overscaled eave as well that folds up and down the facade and highlights new entry points, and it gestures to what is clearly the new emergency department and the new main entrance of the hospital. So from the car parks and the ramps all the way up to the front doors, we try to simplify the patient journey and also improve accessibility, especially for people who are using wheelchairs and mobility scooters. And then underneath the canopy, we see the civic portico. So there's these really large skylights that allow a lot of natural sunlight coming down to the people waiting below. So a public-facing idea of the facade was to identify, list and then represent all of these local towns that the hospital services in the Basque Coast and South Gippsland region. So literally mapping these onto the brick facade, create a really strong visual link, and then visitors can actually engage with this instantly on approach as well. Both the exterior and the interior design draw from the Basque Coast region, and they informed the colour palettes in particular. So with these images, a banding or a strata of all these tones were chosen for the anodized aluminium panels, and then they're applied to the canopy as well as the address facade. Another key moment of the facade is actually a really strong reference to Wonthaggi's mining history, which Basque Coast Health were very keen to represent. So this glazed angle cutout that you see here on the facade is a nod to the poppet head structure. And then on the inside, this space is actually dedicated to a triple height, a spacious and naturally lit atrium where visitors can actually look up and see the next steps of their destination. And then when you turn around, you see the large opening from the inside as well, and it's created these really bright breakout spaces on the upper floors. So now we'll move up the building through the floor plans. In terms of the clinical planning, there was a really strong collaborative design process throughout. So we had consumer and community representatives at each of the meetings. So we have, of course, the ED entry and the main entry to the right. And then down here is the emergency department, ambulance base to the left, and then the medical imaging department that services the whole building. So when you walk into the ED entry, the first space that you're met with is the triage and wait area. So warm finishes were chosen specifically in this area to create a welcoming environment to what is usually quite a stressful place for people. We maximise a lot of natural light as well to all the patient bays, so we prioritise putting all of the patient treatment areas to the perimeter of the building. And then we also worked with the local community, the Historical Society, as well as the Bunurong Land Council to identify and weave traditional and historical narratives into the design as well. So we've got large photographs showing local icons and Indigenous artwork, as well as coal mining scenes, and they're scattered throughout the major public areas as well as circulation points, so they celebrate Bass Coast rich heritage. On level 2, this is the engine room, or the hot floor of the building, and so it's really crucial to get the patient flows right. So when you come out of the public lifts, you admit it at the day of surgery admissions, you have your procedure in the operating theatres, and then you loop that down to recovery, which faces north, and then you exit out to the lifts again. So it's a really simple loop for both patients and staff. And then level 3, we have the 32-bed ward. So it's an efficient 3-sided ward to minimise distances between the staff bases and the patient rooms. And it's actually now named Codell Linen by the hospital to mark the respect of the traditional owners on the land. So when you come out to the public lifts and you go up, you're met with reception, where there's clear wayfinding through the use of colours in both the flooring as well as the ceiling. And multiple courtyards were designed throughout the facility as well for places of respite. So here, patients and carers can actually go outside and get some fresh air without having to leave the building, which is great. And then a highly anticipated, well-used room was the family lounge, where you've got these full-height windows directing views out to Wonthaggi. And then when you turn around, we also have that communal dining area, where you've got those ends of corridor views going out, and just a really great space for gathering. So we believe the success of this architectural proposition was its reception by the community, as you can see here on Community Open Day. So there was a lot of people that gathered here for the smoking ceremony, as well as to take the tours. And we believe this public architecture is a fantastic addition to not only the hospital site, but also to the region of Wonthaggi, and we can see it serving them well into the future.